Today, we will be learning about the Marshall Islander culture and delivering culturally competent care. Feel free to pause this video at any point in time in order to view the information in more detail. The objectives for this video are to increase your knowledge of the Marshallese culture in order to improve the healthcare for diverse populations, to define cultural competency and why it is important, and to identify ways to alter care to better serve Marshall Islander patients and their families. The Republic of the Marshall Islands are located in the Central Pacific Ocean just above the equator. Their history with the United States begins in 1946 when the U.S. tested nuclear weapons in the Marshall Islands until 1958. From this, the natural food supply was contaminated and lifestyle and diet changed. Packaged and canned foods became a staple and remain so to this day. The Compact of Free Association was created in exchange for military base access. In this agreement, the Marshallese are considered non-immigrants without visas and are not subject to U.S. Citizenship and Immigration Services Administration. The Compact of Free Association was approved in 1986 and Marshall Islanders were Medicaid and CHIP eligible. This ceased with the passage of welfare reform in 1996. They are excluded from federal Medicaid, but state government does have the option to continue Medicaid using state funds. However, Arkansas does not offer this. Only Marshallese children who are born here can receive coverage. Marshallese migrant children in Arkansas cannot receive Children's Health Insurance Program funding, and the result is that approximately 50% of Arkansas Marshallese are uninsured. Current government legislation views proposed legislation as something new versus restoring what has already been taken away, such as Medicaid and CHIP. Some emerging challenges Marshall Islanders face are the growing homeless population in Hawaii, which number over 1,000, and those with the greatest healthcare needs will seek migration to the United States because they view it as a life-saving measure. Over 23,000 Marshall Islanders live in the United States according to a 2010 census, but since then, using school enrollment data, about 40,000 Compact of Free Association migrants live in the United States, and of those, about 12,000 live in Arkansas. This means that Arkansas has the largest population of Marshallese Islanders in the United States outside of Hawaii. So, why is all of this important? Well, by 2020, Pacific Islanders will be the third highest in rate of migration to the United States behind Latino and Asian. Major health disparities include diabetes, obesity, and heart disease. The average Marshallese household is 7 people, where the eldest female tends to make most decisions for the family, including medical decisions. The Marshallese can come and go to the islands freely since they are migrants, and it's very common for Marshall Islanders to send money, food, and more back to their family on the island. So what is cultural competency? A culture is made up of knowledge, beliefs, behaviors, and language, communications, actions, customs, values, and personal identification. Cultural competence is the ability of a nurse to acknowledge, understand, respect, and individualize nursing care to a patient's cultural values, attitudes, and beliefs. It has a positive effect on patient care delivery and enables providers to deliver respectful care that is responsive to health beliefs, practices, and cultural and linguistic needs. Key cultural values of Marshall Islanders include working as a group and supporting each other are essential. Family and community has a central role. Family is extremely important. Good people are generous, helpful, dependable, and attentive to the needs of others. This contrasts with individualistic cultures that emphasize assertiveness and independence. Church is the center of all activity. The pastor is a community leader and is greatly respected. And the first birthday is a milestone and greatly celebrated with extravagant parties. This is mainly due to the fact that the infant mortality rate in the Marshall Islands is almost 30% versus 6% in the US. When comparing views on life and living in Marshallese and Western American cultures, the Marshallese culture would say, "What will be, man's life is controlled by destiny," versus the Western culture saying, "We create our own future by what we do." Marshallese say, "Work a little, rest a little. Whatever you do, try to keep other people happy." Whereas the Western culture might say, "If you work hard enough, someday you will make it to the top." The wise man is one who knows his place in the world, respects authority, and does what he is supposed to, versus the wise man strikes out on his own and makes his own decisions. Now, how do you cultivate relationships with your Marshall Islander patient and family? Use your first name, such as Nurse Christina. Start with small changes. Involve the family when possible and avoid focusing on just the patient. Instruction should be given to everyone in the room. Listen and learn. And while it might be an issue, make an effort to establish trust. Sometimes personal information is viewed as sacred and is not freely given. This is especially important with elders, largely due to the nuclear history with the United States. An example of discharge instructions can start by verifying who the caregiver is and the language that is spoken. Don't assume anything. Next, educate all family if possible using a translator or another family member as needed. It is best if instructions are not all given at once, so space them out over the course of their stay. And lastly, verify that they have access to what they might need, such as transportation, finances to buy supplies, etc. Important considerations for providing healthcare to Marshallese are that Marshallese in Northwest Arkansas often share a vehicle among many family members, so they might not have a ride but don't want to tell you that they don't have a ride. Poverty is high. 98% of Marshall Islander students in Springdale schools qualify for free lunch. Marshallese do not regularly adhere to clock time, so be flexible with scheduled times such as appointments and pickups. And they might not seek preventative care until they are acutely ill. Most Marshallese communicate primarily in Marshallese and speak English, but they may not be proficient or speak English well, so keep this in mind when educating and caring for your patients. We interviewed several Marshallese women about their experiences with healthcare in the United States. Some things they didn't like included people assuming that no one knew how to communicate, not explaining what was going on or talking when checking on the patient, and having a limit on family members allowed in the room during birth. This stems from being in the Marshall Islands and not knowing if the mother was going to survive the birth or not. So, just in case, they would want the whole family to be present. On the other hand, some things they did like were the way their babies were treated and how well our doctors are trained. Next, we asked, what are some things you wish your healthcare professionals knew? They said that Marshallese might not ask questions unless they are concerned. They will usually do what they're told because they trust the professional's opinion. However, they might not ask questions because they're scared to say the wrong word. Ask them, do you need help or speak English? And try asking before other Marshall Islanders show up so that they are not embarrassed. They might make more of an effort or an attempt to try to communicate if you are one-on-one. If they are still not understanding, then ask if they would like a translator or another family member to help. Some other fun facts these women shared are that touching a baby's head is frowned upon unless you are directly taking care of it. Placing a piece of paper on a baby's forehead between the brows can cure hiccups. Rolling a raw egg on your stomach can help speed up labor. And that drinking herbs from the Marshall Islands during pregnancy can help lessen your pain during labor. To wrap up, we will visit our objectives one more time, which were to increase your knowledge of the Marshallese culture in order to improve the healthcare for diverse populations, to define cultural competency and why it is important, and to identify ways to alter care to better serve Marshall Islander patients and their families. Thank you for watching this video, and we hope that you've learned more about the Marshall Islander culture and delivering culturally competent care.